Okay. Well, we're just gonna be for a brief moment tonight, but I just want to say like it's been over the past I want to say 5 years or so that I've learned more and more about pelvic floor therapy, and I've just been like, where are they? And then I met you guys. So I was excited to find some pelvic floor therapists that I could relate to in the state of Georgia.
Yeah.
So briefly, could you guys tell us why the pelvic floor is important? Because I have patients who have issues with like urinary incontinence. You know, people are like, oh, well, I've had children, whatever. It comes with the territory. But can we just talk about why the pelvic floor is important?
Absolutely. So the pelvic floor is super important because it's basically the bottom of your core system. So when we talk about the core, people think we're just talking about your abs or like your six-pack muscles. But that's just the front. It's just the beginning of it. You have your diaphragm up top, you have stabilizing muscles in your back, and then you also have those muscles in your pelvic floor. So you can imagine how important they are because they hold up everything. And not only are we talking about the muscle system of your whole core, but we're also talking about the organs in your pelvis. Y'all see my beautiful pelvic model? So that's your bladder up front, close to your pubic bone, your uterus in the middle, and it's kind of moved to the side, but that's your rectum back there by your spine. So all of these muscles, all of these organs in a mom's or any woman's pelvic inlet have to be supported by something. There's ligaments and things there, of course, but those muscles are also a sling or like a hammock to support those organs. And so when you do get pregnant, a lot of things change. And those muscles have a lot more abdominal pressure, you can imagine, with the growing baby and all of that fluid to support. So sometimes those muscles get a little bit more lax, a little bit stretched out. Even the act of giving birth can make those things happen. And because of that, sometimes those muscles get weaker. When they get weaker, the organs are not supported as well. So sometimes you might get symptoms like leaking urine when you laugh or cough, or you might get that urgency to go to the bathroom. As soon as you feel the need to use the bathroom, you may be feeling constipation, or you may leak feces as well. So all of these things can happen just throughout the course of life, not just for those who are pregnant, but a lot of times, like you said, those are the people who mention incontinence a little bit more. But that's some of the reasons why the pelvic floor is important. Also for sexual function as well.
Yes. A lot of times patients don't like to talk about issues with sexual function, um, because for them, if they don't have a good relationship with their physician or their primary care provider, um, it's embarrassing for them. So, just making space for them to feel comfortable to talk about those things and knowing that they're not the only ones. Like, is there something wrong with me? Well, there's something that we can probably help you with going on there. And that's why I think pelvic floor therapy is good for not only, urinary incontinence, but like sexual dysfunction, as you said as well. Let's not leave our men out. What are some things you've seen in men?
You see different sexual dysfunctions in men. Um, this is just a blanket statement. It can affect anybody, but in older men, sometimes it's related to the prostate. So men who have prostate cancer or who have to have different surgeries related to that can experience some type of pelvic floor dysfunction after. And that may be like leakage. They may have difficulty with obtaining or maintaining an erection, but also in younger men. So men who are really heavy strength trainers, sometimes those pelvic floor muscles get too tight and they don't realize it, because a lot of times men don't stretch, they just strengthen, and those muscles get really tight, and they may have things like urinary urgency or frequency, so having to go to the bathroom multiple times a day. When they do go, maybe not being able to void everything or feeling like it's an incomplete empty, so they have to kind of go to the bathroom twice at a time
Mm.
to completely empty. They may have some pain with erection or pain with ejaculation, things like that. So a lot of times you see that in those like CrossFit like athletes, the guys that are like, or power lifters, things like that.
That's interesting, because it takes, like I said, a lot for a patient to say, "Hey, I'm having these problems." So if you have some of these super ultra athletes and things like that, they may not tell you till it becomes just an unbearable issue.
Yeah.
But it's good to have that relationship with your primary care to get those things taken care of. Now, what can a pelvic floor therapist do for us?
So we can do a lot. So usually, because people are usually afraid, like, what are you actually gonna do? What is it really? What's really going on? So most of the time, if you've ever been a physical therapy before, it's not much different than going to physical therapy for your shoulder injury, your back injury, your ankle injury. We usually, just like any other doctor's office, you have some forms you need to fill out. When you come in PT, usually we have a little bit more one-on-one time with you. So that'll look like us just interviewing you, because with pelvic floor therapy, we learn a lot from you. So we really want you to be as descriptive as possible about the symptoms that you're experiencing, because that kind of gives us, we kind of put our private detective hats on. So whatever you say kind of gives us a clue on what we want to do going forward. And so then we'll do a regular physical exam, all your clothes on, just like we usually do, looking at range of motion and strength and balance, things like that. And then flexibility. And then we might go into, if it's warranted based off of your symptoms and the things we discuss, we will do an internal exam. And if it is a female, that kind of looks like you undressing from the waist down. And then we just use one gloved and lubricated finger in your vaginal canal. Once we're able to go inside, we can feel the tone and the strength of those pelvic floor muscles and see if you have any pain in those muscles. So you can imagine if my finger's in the middle there and I'm moving my finger from side to side, I can feel all of those muscles that's supporting those pelvic organs. And that'll kind of give me a clue into if some pressure in a certain area relieves your pain or increases your pain. That gives me a clue as well. If it is a male and we have to do a pelvic floor exam, we will have to use that glove and lubricated finger in the anus, going through the anus, through the rectum to feel their pelvic floor muscles. And we can also do some palpation on the outside of those muscles as well. Then we kind of determine what's going on and we set a game plan. And that looks like a lot of exercise, but we also have a lot of fun tools that we use to assist with actually targeting those pelvic floor muscles as well.
That's awesome. I just want to say, like, that helps so many people, like, just to even know that your pelvic floor matters. And if you're having issues, there are things that can be done, medically, but also, if you have to have physical therapy for anything else on your body, you can have therapy for your pelvic floor as well, to help with any issues. I see Catherine, she chimed in here, um, talking about helping women to prepare for birth and even postpartum type. What type of things can you help with there?
Yeah, that is my love. That's my passion. That's what I really love to do. And that's my favorite population of folks to work with, those who are pregnant and postpartum. So there is so much that you can learn about your body when you're pregnant, and it really helps to just be educated. You can't know enough, and a lot of times you learn a little bit more each pregnancy. But when it comes down to the pelvic floor, a lot of our education is about trying to decrease the risk of tearing. So sometimes moms have some tearing in that space between the vagina and the anus there. And so there are different stretches and there are different massage techniques that you can do to kind of decrease your risk of tearing there. I mentioned the core system earlier in the live, and so that's super, super important for those who are pregnant because it gets all out of whack when your belly extends so far in front of you. So your postures change. We talked about how the abdominal pressures change. And so all of those things affect your pelvic floor. And so it's important to learn how to use that core system and manage those pressures to aid in delivery. So the pelvic floor, let's debunk a myth while we're here. The pelvic floor does not push your baby out. So don't think if you do a billion Kegels, it's going to help you push the baby out. It's not. Your uterus is the queen of the show. So uterine contractions, which are involuntary, will push the baby out. Your job is to learn how to use your breath and relax those pelvic floor muscles to allow the uterus to do its job, the pelvic floor to get out of the way, and the baby to exit as easily as possible. And that's what I love to teach moms how to do when they're getting closer to delivery. And postpartum, we got to recover, and we have to recover safely. So even if you are an athlete and you're used to going hard and you hate to do the workouts where you're not really sweating, you feel like you're not working out hard enough, take your time. If
Yes.
if we put too much stress and strain on the pelvic floor, if we return to running 6 weeks postpartum, you might not be ready and you may start to cause more damage than you really know. Even if you feel fine, it's still important to just gradually reload your core system postpartum. And I love to help moms do that as well so they can return to whatever activity it is that they're used to doing safely.
Awesome. And with women with C-section scars, you can help with the scarring too, right?
Absolutely, absolutely. There are a lot of different manual techniques that we can do for that. There's some that we can show mom. So it's important to first and foremost desensitize the scar. So that looks like applying light touch to around the scar. I mean, we're talking about a couple of days after the surgery. And light touch, I mean, like if you wear a headscarf or a satin bonnet to sleep, like something light like that, just gentle
Oh, okay.
strokes around it. And you can go parallel, you can go perpendicular, you can go in circles around the scar. You don't want to go over an open incision. So
Right.
just to basically wake your nerves up and to introduce touch to your body and let your body know light touch is not pain, because if you avoid touching it, then you're sometimes those wires get crossed and your body later on down the line will recognize light touch as pain, and you don't want to do that. So just don't be afraid of it. Go around it until it heals, and once it heals, you can apply a little bit more pressure. You can use more firmer surfaces like a rough washcloth or something like that to go around it. And then when you're ready, when it's healed, you can kind of go over that scar to kind of help flatten the appearance. And like I said, to decrease pain and break up those incisions. And Dr. Evans, I get so many people who say and it seems small, but just the desensitizing thing changes the game for them. Like, okay, I like my pants rubbing against my C-section scar doesn't hurt anymore because I took the 2 to 5 minutes a day to just desensitize it.
And you just think about like that scar is right at the panty line, right at where your pants, your shorts, or anything like that. If they're like you know, right at the waist and things, they
Mm-hmm.
hit like right there. So you just think about the day to day things that could cause issues with.
My gosh, yes. It sounds uncomfortable. I don't have any children and I don't have a C-section scar, but I can just imagine how uncomfortable, that can be if you don't just adjust your body to those touches.
Yeah. And what about posture?
As it relates to people who are pregnant or just in general?
I would say for women, I see Catherine is here she's talking about teaching moms about their posture and things
Okay.
and how to do things properly.
Oh, that's a good one. That's a good one. I will say that when you are pregnant, just on the basis of what changes in your abdomen, it moves your low back into what we call like excessive lordosis. So that's just a deeper curve in your low back. So basically like your butt sticking out and your belly sticking out. Okay. So there's a big curve there. There's a lot of pressure on your low back. That's why a lot of people who are pregnant also complain of back pain, because you have a
Mhm.
really big change in your posture and a lot of strain on those stabilizing muscles of your core system and your low back. And so we like to teach folks just different exercises to kind of move out of that posture a little bit and to maintain more of a natural curve in your low back, so not super excessive. And so for folks who are pregnant, we can't really change that exactly until, after you have the baby, but we can work those muscles in a way that they're not being worked out throughout the day because of the change of posture. So it looks like exercises like pelvic tilts, kind of basically tilting your butt bone under. Like if you were like a sad dog and you had to kind of like tuck your tail in, that kind of motion. Or if you were getting like a spanking and you want to tuck your butt in so you don't feel it, that motion kind of helps move your back out of that posture. And then stabilizing or strengthening those deep core muscles as well. And that doesn't look like sucking your stomach in. It's a very small movement, and you can almost see your belly button kind of go in and up a little bit. And that's how you know you're getting that deepest muscle that goes around your belly and your back. It's like a built-in waist trainer. But it's easy to miss if you try to contract your abs really hard. And so that takes a lot of education usually for our patients. Um, but yeah, you just want to, if you're lifting, and if you're anyone really, but if you're someone who is pregnant and you're lifting from floor to waist, you just want to make sure that the item is really close by you. So you don't want to be reaching out to lift anything. You want that item to be as close to you as possible. You want to squat down to pick up, not bend at your back, but use your knees and squat down to lower. Hug that item, keep it close to you, engage your core like we talked about, and lift
Mhm.
up that way.
It's a lot.
It's a lot. So you gotta kind of think about that when you're picking up your baby from the floor, because you might have like
Right,
a 2-year-old and a newborn, So you got to think about
right.
your posture when you're doing that, your posture
Hmm.
when you're breastfeeding. I mean, feed or just feeding in general. So many things.
That's true. That's true. You think about how all the women who have issues with their back and things, not because of birth in general per se, but because of all the things they're trying to complete around the house and things like that. All the posture issues nobody tells you about
Yeah.
up front. So you start having issues, but those are some good preventive things just to know up front before um, you're having to carry any children around and things like that. I had mom's thumb.
Did you?
Um, yeah, that was something else. But every time my child gained weight, it aggravated it because of
I can
picking
see
her
that.
up, you
Yeah.
know.
It's the
So
all the times you do this motion throughout the day, whether it's like
yeah,
feeding the baby or picking the baby up or folding
yeah,
laundry, it's like repetitive.
yes. And then like the back issues that you talked about and things like that. Those things matter. Like they add up. If you think about all the things that are going on, postpartum or even while a mom is pregnant,
Mm-hmm.
um, those type of things add up and they wear on you. So if you have tips and things like that to better your posture and just better your body mechanics, that goes a long way.
Yeah.
It makes a
And
difference.
you're right. Everything does add up. And I just want to make the point for anybody who's listening who might share this with someone that you do not have to be in pain to seek help from a physical therapist or to refer a patient to see a physical therapist. We can, like Dr. Evans was saying, we can work in that preventative space. I'm a big advocate for anyone who is pregnant or postpartum to see a PT. It may just be one visit just to talk like this for education, like Dr. Evans was saying, just for things to look out for that you may not have ever thought about. And it'll go a long way. You may not have to deal with all of this stuff that we're talking about. Or if you do, you'll have the education and information you need to handle it on your own if you can, or you know who to seek help from if you can.
Right, right.
Yeah.
And that brings me to when we're talking about referrals and things like that. How do you ask your OB or midwife, or if you're even past that time frame where you're seeing them, your primary care, if you're not seeing an OB or a midwife, how do you ask for a referral
For PT?
for PT?
You just, you know, and this, you might help me more on this, but I always tell folks, you know, a lot of times people seek my help when they are pregnant or postpartum, and so they're like in really good communication with their OB at that point, and they have
Mhm.
visits scheduled regularly. And I'm like, okay, next time you go in, just mention the symptoms that you're having, and you can let them know that you have a PT that you want to see. Usually, I hadn't got much pushback by doctors. They're like, okay, you know, if that's what you need, they, you know, write the referral. You bring the referral to the PT. They see you that way. In the state of Georgia, we PTs can see patients direct access, so we do not have to have that referral from the doctor for the first 30 days. Then after 30 days of care, then we would need some like a signed one of our notes from the doctor just overseeing the patient or a referral at that point. But you really just
Mhm.
have to ask. And that's the thing, just mention it, because a lot of physicians don't know any pelvic PTs to refer their patients to. So if you
Mhm.
know of one, you just let them know, hey, I know this pelvic PT. I really want to seek their care for preventative care, or because I have incontinence or my back hurts, or I have mom thumb or whatever it is. But you gotta let them know.
Right, right. Um, that's one of the things I always say is like ask questions. You don't know, like you said, until you open your mouth and say something.
Yeah.
So that it's very important to have that type of communication with your doctor.
Yeah.
All righty, ma'am. It's been so nice to see you today.
Yes. Good
I
to
know
see
you
you.
guys will be joining me again in the month of August.
Yes, can't wait to talk about Operation Mist with you.
Yeah.
Yes.
And how do we find you on social media?
My Instagram is DRJT_ the pelvic PT. And I try to put tips on my Instagram for anybody who will listen and share, just for preventative care mainly.
Awesome. Awesome. And if you're looking for a primary care provider, Rejuvenate Family Health offers a unique model called direct primary care. And we'd love to just sit down and talk and help you with your journey on this on wellness. And I'm just excited that I found you and Catherine. So
Yes.
we
We are
will be
excited.
talking more.
Yes, because I love the whole concept of direct primary care. I tell everybody I know, it's amazing. So,
Well, we thank you.
you're
it,
welcome.
it the model is growing across the country, and patients love it, and the doctors do too. So that makes a difference.
Yeah. It's
Um,
good for everybody's quality of life, I think.
yes, and if you want to follow Catherine, let's not forget Catherine.
Yes.
Uh, she is Scars to Beauty Marks on IG and Rediscover Your Music on Facebook.
Yes. Yes.
So I thank you all for spending a little time with us this evening, and we'll see you guys again.
Okay. See you in August.
See you later. Bye. Have a good one.
You too.